Welcome, everyone. My name is John Crues. I wish I could be with you today. My first lecture is going to be on MRI's impact on understanding the pathophysiology of musculoskeletal diseases. Here are my disclosures. I'd like to talk a little bit about subchondral bone trauma, tendon injuries, and then about obesity. So all of you have seen this. Here we have subchondral trabecular bone injury. We've got marrow edema, and we have a serpiginous area of low signal intensity within the subchondral bone due to dephasing of the spins from compressed trabecular bone due to fractures. The closer this is to the subchondral plate, the higher the risk of the cartilage is adjacent to it, and the increased risk for developing degenerative joint disease. The farther away it is, the less the risk for degenerative joint disease. We first recognized the importance of these back in the 1980s. This was one paper that we published back in 1989. We looked at the first 434 consecutive knee MRIs we performed in Santa Barbara, California for knee pain. 83 MRIs showed acute bone edema. Only 3 X-rays were positive. 38 of these patients had arthroscopy. 11 showed abnormal cartilage. Only a few had meniscal tears. So most patients with knee pain and acute bone injuries did not have meniscal tears at the time of arthroscopy. So what we realized at that time was that meniscal tears were not the most common cause of knee pain, which was kind of thought at the time, and that X-ray occult bone injuries are a significant cause of knee pain. And these bone injuries cannot be detected in general by arthroscopy because they're below the cartilage, and the arthroscopist cannot see there, and almost all of them are negative by X-rays. So here's an acute subchondral trabecular bone injury. Often the overlying articular cartilage is completely intact. The problem is that the bone is rigid, and therefore it fractures when it gets compressed, whereas the articular cartilage is much more viable and often is not injured at the time of the acute injury. And here we can see it there. If you have a greater force, you can actually get impaction of the bone itself and tearing of the overlying articular cartilage. And in following a lot of these patients, this is a significant increased risk for going on and developing subchondral bone marrow edema, greater loss of articular cartilage, and eventually degenerative osteoarthrosis. So these bone injuries are significant, and what we really have to do is pick them up before you actually get any impaction of the bone and allow them to heal. Now, this is what can happen in young athletes. This is a 12-year-old with knee pain and giving out. What we can see is there is a subacute subchondral trabecular bone injury here with marrow edema. The overlying articular cartilage is intact. This is in the coronal plane. In the sagittal plane, again, we see the cartilage is intact where the subchondral cystic changes, and this is, at this time, a subacute subchondral trabecular bone injury. Now, this was a young athlete. He continued to do athletic activities. This was now in 7/14/06. Now, about 5 years later,